Disorders of the human reproductive system. There are several disorders of the human reproductive system that can affect fertility, sexual function, and overall reproductive health. Some of these disorders include 1. Polycystic ovary syndrome, PCOS, a hormonal disorder that affects women, characterized by the growth of small cysts on the ovaries, irregular periods, and high levels of male hormones. 2. Endometriosis, a condition where the tissue that lines the uterus grows outside of it, causing pain, heavy menstruation, and sometimes infertility. 3. Erectile dysfunction ED, a condition where a man has difficulty achieving or maintaining an erection, often related to underlying health conditions such as diabetes or hypertension. 4. Premature ovarian failure POF, a condition where a woman's ovaries stop functioning before the age of 40, leading to infertility. 5. Infertility, the inability to conceive a child after 12 months of trying, often due to issues with ovulation, sperm production, or blockages in the reproductive tract. 6. Sexually transmitted infections STIs, infections that can be transmitted through sexual contact, such as chlamydia, gonorrhea, and human papillomavirus HPV, can affect fertility and overall reproductive health. Other disorders of the reproductive system include uterine fibroids, male hypogonadism, and prostate conditions such as prostatitis and prostate cancer. Many of these conditions can be treated or managed with interventions such as medication, lifestyle changes, surgery, or assisted reproductive technologies. Disorders of the female reproductive system. There are several disorders that can affect the female reproductive system, including 1. Polycystic ovary syndrome, PCOS, a hormonal disorder that affects women, characterized by the growth of small cysts on the ovaries, irregular periods, and high levels of male hormones. 2. Endometriosis, a condition in which the tissue that lines the uterus grows outside of it, causing pain, heavy menstruation, and sometimes infertility. 3. Pelvic inflammatory disease PID, a bacterial infection of the female reproductive system that can result in scarring and blockages in the fallopian tubes, leading to infertility. 4. Uterine fibroids, benign tumors that grow in the uterus and can cause heavy bleeding and pelvic pain. 5. Ovarian cysts, fluid-filled sacs that can form on the ovaries, which may cause pain, irregular periods, or fertility issues. 6. Premenstrual syndrome, PMS, a group of symptoms that some women experience in the week or two before their period, including mood swings, bloating, and breast tenderness. 7. Menopause, the natural cessation of menstruation and fertility, usually occurring between the ages of 45 and 55. 8. Cervical cancer, a type of cancer that can develop in the cells of the cervix, often caused by infection with certain strains of the human papillomavirus HPV. Many of these conditions can be treated or managed with medication, lifestyle changes, or surgery, depending on the severity of the condition and the individual's goals for fertility and overall health. Disorders of the male reproductive system. There are several disorders that can affect the male reproductive system, including 1. Erectile dysfunction ED, a condition where a man has difficulty achieving or maintaining an erection, often related to underlying health conditions such as diabetes, hypertension, or depression. 2. Premature ejaculation, a condition where a man ejaculates sooner than he or his partner would like, often due to psychological factors, sexual inexperience, or medical conditions. 3. Benign prostatic hyperplasia BPH, a condition where the prostate gland enlarges and obstructs the flow of urine, leading to difficulty urinating or frequent urination. 4. Prostatitis, inflammation of the prostate gland, often caused by bacterial infection. 5. Testicular cancer, a type of cancer that can develop in the testicles, often characterized by a lump or swelling in one or both testicles. 6. Infertility, difficulty conceiving a child, often caused by issues with sperm count or quality, blockages in the reproductive tract, or hormonal imbalances. 7. Varicocele, a condition in which veins in the scrotum become enlarged and can cause pain, swelling, or infertility. Many of these conditions can be treated or managed with medication, lifestyle changes, or surgery, depending on the severity of the condition and the individual's goals for fertility and overall health. It is recommended to consult with a healthcare provider if there are any concerns regarding male reproductive health. Complications of the reproductive system. Complications of the reproductive system can be varied and depend on the specific disorder or condition affecting the reproductive organs. Some of these complications may include 1. Infertility, the inability to conceive a child due to factors such as hormonal imbalances, blockages in the reproductive tract, low sperm count, or genetic disorders. 2. Sexual dysfunction, the inability to achieve or maintain an erection in males, or achieve orgasm, in females. 3. Pain. Pain during intercourse or chronic pelvic pain can be caused by conditions such as endometriosis, uterine fibroids, or pelvic inflammatory disease. 4. Cancer. Reproductive system cancers can occur in both males and females and can include cancers of the breast, cervix, uterus, ovaries, prostate, and testicles. 5. Infections. Sexually transmitted infections STIs, such as gonorrhea, chlamydia, syphilis, or HIV/AIDS can cause long-term damage to the reproductive organs and can lead to infertility or cancer. 6. Pregnancy complications. Complications during pregnancy, such as ectopic pregnancies, gestational diabetes, preeclampsia, or preterm labor, can be life-threatening for both the mother and baby. 7. Menstrual irregularities. Disorders such as heavy bleeding, irregular periods, or amenorrhea absence of menstruation can be caused by conditions such as PCOS, thyroid disorders, or hormonal imbalances. Treatment for these complications varies and depends on the underlying cause of the disorder or condition. It's important to seek medical attention if there are any symptoms or concerns related to the reproductive system. Problems associated with underage, overage, too many and too close pregnancies. There are several problems associated with underage, overage, too many, and too close pregnancies. 1. Underage pregnancies. Teenage pregnancies can lead to complications such as premature birth, low birth weight, and fetal death. In addition, teenage mothers are more likely to experience depression and anxiety during and after pregnancy, and may face challenges in completing their education and finding stable employment. 2. Overage pregnancies. Pregnancies in women over the age of 35 can increase the risk of complications such as gestational diabetes, preeclampsia, and preterm birth. Older mothers may also face challenges in conceiving naturally and may need to undergo assisted reproductive technologies such as IVF. 3. Too many pregnancies. Having too many pregnancies, often referred to as high parity, can increase the risk of complications such as preterm birth, low birth weight, and maternal mortality. In addition, too many pregnancies can lead to physical, emotional, and financial strain on the mother and family. 4. Too close pregnancies. Pregnancies that occur too soon after a previous birth can increase the risk of complications such as preterm birth, low birth weight, and maternal mortality. In addition, too close pregnancies can lead to physical and emotional strain on the mother and may make it difficult to care for multiple young children at the same time. It's important to engage in family planning and consult with healthcare professionals to ensure that pregnancies occur at an appropriate time and are spaced out appropriately. This can help to reduce the risk of complications and support the health and well-being of both the mother and child. Socio-cultural factors associated with underage, overage, too many and too close pregnancies. Socio-cultural factors can play a significant role in the occurrence of underage, overage, too many, and too close pregnancies. Some of these factors include 1. Lack of education. A lack of access to education, especially for girls and young women, can contribute to early and frequent pregnancies. Education can help individuals make informed decisions about reproduction, family planning, and pregnancy. 2. Poverty. Poverty can make it difficult for individuals to access healthcare, family planning services, and contraception, which can increase the risk of unintended pregnancies. Poverty can also contribute to large family sizes and short birth intervals, as families may rely on children to provide labor or income. 3. Cultural norms. Some cultures may value large families or early marriage, which can increase the likelihood of underage, too many, and closely spaced pregnancies. In addition, cultural beliefs may limit women's autonomy and decision-making power in regards to their own bodies and reproductive health. 4. Limited access to healthcare. Lack of access to healthcare, especially in rural and remote areas, can make it difficult for individuals to access prenatal care and family planning services. This can increase the risk of pregnancy complications and unintended pregnancies. 5. Gender inequality. Gender discrimination and inequality can limit women's autonomy and decision-making power in regards to their reproductive health. This can lead to early, frequent, and closely spaced pregnancies, as well as limited access to healthcare and family planning services. Addressing socio-cultural factors associated with underage, overage, too many, and too close pregnancies requires a multifaceted approach that includes education, access to healthcare, cultural sensitivity, and addressing gender inequality. This can help individuals make informed decisions about their reproductive health and support the health and well-being of mothers and children. Ways of minimizing complications and disorders of reproductive system. To minimize complications and disorders of the reproductive system, you can take the following steps. 1. Practice safe sex. Use barrier methods, such as condoms, to prevent the transmission of sexually transmitted infections (STIs) that can cause reproductive system infections and complications. 2. Regular checkups. Make sure to undergo regular checkups with your healthcare provider to ensure any reproductive system concerns are caught in their early stages. 3. Maintain a healthy weight and diet. Maintaining a healthy weight and eating a balanced diet can help prevent reproductive system disorders such as polycystic ovarian syndrome, PCOS, and endometriosis. 4. Exercise regularly. Regular exercise can help maintain a healthy weight, reduce stress, and improve blood circulation, which can all support healthy reproductive function. 5. Quit smoking and drinking alcohol. Tobacco use and alcohol consumption can disrupt hormones and contribute to reproductive system disorders and complications. 6. Get vaccinated. Certain vaccinations such as HPV vaccination can help prevent cervical cancer, a common reproductive system disorder. 7. Manage stress. Chronic stress can affect reproductive function and increase the risk of reproductive system complications. Finding healthy ways to manage stress such as exercise, meditation, or therapy can support reproductive health. Overall, maintaining a healthy lifestyle and taking preventative measures can help reduce the risk of complications and disorders of the reproductive system. Regular checkups with your healthcare provider can help catch any concerns early on and provide appropriate treatment. Revision exercise. 1. Define the terms. A. Ectopic pregnancy. B. Fibroids. C. Impotence. D. Stillbirth. A ectopic pregnancy. A condition in which a fertilized egg implants and begins to grow outside of the uterus, usually in the fallopian tubes. B. Fibroids. Non-cancerous growths that develop in or around the uterus, often causing heavy menstrual bleeding, pain, and other symptoms. C. Impotence. Erectile dysfunction. The inability to achieve or maintain an erection sufficient for sexual intercourse. D. Stillbirth. The delivery of a baby that has died in the womb or during labor after the 20th week of pregnancy. 2. Give examples of cultural practices that lead to underage pregnancies or too many pregnancies. Cultural practices that can lead to underage pregnancies or too many pregnancies include: 1. Early marriage or forced marriage. In many cultures, young girls are married off or forced into marriages at a young age, which leads to early pregnancies before they are physically, emotionally, or financially ready to have children. 2. Lack of education. In some cultures, girls are not allowed to attend school or complete their education, which limits their opportunities for employment and financial independence. This can lead to early marriages and a higher likelihood of having more children than they can support. 3. Religious beliefs. In some religions, large families are considered a blessing, and birth control is discouraged. This belief can lead to large families, putting a strain on resources and leading to poverty. 4. Lack of access to contraception. In some cultures, there may be limited access to contraception, which can result in unintended pregnancies and a higher likelihood of having too many children. 5. Traditional gender roles. In some cultures, women are expected to bear many children as a symbol of their femininity and ability to bear offspring. This can put a strain on their physical health and limit their opportunities for education and employment. Overall, cultural practices can play a significant role in leading to underage pregnancies or too many pregnancies. It is essential to educate communities about the consequences of early or too many pregnancies and promote access to education, healthcare, and contraception to support family planning. 3. What would be the result of underage pregnancies? Underage pregnancies can have several consequences, both immediate and long-term, including 1. Health risks. Young mothers are at an increased risk of developing pregnancy-related complications such as anemia, high blood pressure, and gestational diabetes. Additionally, babies born to teenage mothers are at higher risk of being born prematurely, low birth weight, and developmental problems. 2. Limited education and career opportunities. Teenage mothers are more likely to drop out of school, limiting their educational and career opportunities. This can make it difficult for them to support themselves and their children financially. 3. Social stigma. Teenage mothers may face social stigma and negative perceptions from their peers and community. This can impact their mental health and self-esteem. 4. Financial difficulties. Teenage mothers may face financial difficulties, as they are often not financially stable and lack resources to support themselves and their children. 5. Interpersonal and familial conflicts. Teenage pregnancies can create conflicts within families, as parents or guardians may struggle with accepting and supporting their young children as parents. Overall, underage pregnancies can have long-lasting impacts on young mothers and their children. It is essential to promote education, access to health care, and contraception to prevent unintended teen pregnancies and provide support to young parents.